Discogenic low back pain, or DLBP, is a major cause of chronic low back pain worldwide. It often results from degeneration of the intervertebral discs, which can trigger inflammation and persistent discomfort. Affecting nearly 39% of chronic low back pain sufferers, DLBP not only limits physical function but also impacts quality of life. Traditional treatments like physiotherapy, exercise, and oral medications often provide limited relief. As a result, researchers and clinicians have explored new, minimally invasive procedures that target the disc itself. In this video, we'll break down these intradiscal procedures, their effectiveness, and the risks involved, helping you understand the latest in DLBP management. Intradiscal procedures are minimally invasive treatments that target the intervertebral disc directly. Typically performed through a small needle under imaging guidance, these interventions aim to relieve pain by reducing inflammation or altering nerve signaling within the disc. Common techniques include steroid injections, methylene blue injections, platelet-rich plasma PRP injections, intradiscal electrothermal therapy IDET, and radiofrequency method. These procedures are considered when conservative treatments fail but before surgery is deemed necessary. While they offer hope for many, questions remain about their long-term benefits and potential risks, especially regarding disc health. Steroid injections into the disc have been widely studied for DLBP. These injections aim to reduce inflammation and provide pain relief. However, research shows that the benefits are usually short-lived, often lasting less than a month. Improvements in physical function are minimal, and the risk of disc injury from the needle itself is a concern. While infection risk is not significantly increased, the overall evidence suggests that steroid injections are not the best long-term solution for DLBP. As a result, their use in clinical practice is declining, with many experts recommending other options for sustained relief. Methylene blue injections have been explored as a novel treatment for DLBP, targeting nerve endings within the disc to reduce pain. Some early studies suggested significant pain reduction lasting up to a year. However, more recent rigorous trials found no significant difference between methylene blue and placebo, leading to doubts about its effectiveness. Concerns about potential neurotoxicity and unnecessary intervention risks have further limited its adoption. Today, methylene blue injections are rarely used in clinical practice, as the evidence does not support their routine use for discogenic low back pain. PRP injections are gaining attention for their potential to promote tissue healing and reduce inflammation in DLBP. PRP is rich in growth factors and cytokines that support tissue repair. Several studies have reported positive outcomes, including reduced pain and improved function at 6 months post-injection. However, the number of high-quality studies is still limited, and long-term effects remain uncertain. As research continues, PRP is considered a promising, emerging modality, but more large-scale trials are needed to confirm its effectiveness and safety for discogenic low back pain. Intradiscal electrothermal therapy, or IDET, involves inserting a heated catheter into the disc to modify its structure and reduce pain. While some patients experience pain relief and improved function, studies show inconsistent results with no clear advantage over placebo. IDET also carries risks, including thermal injury, disc deformation, infection, and even neurological complications. Due to these concerns and the lack of consistent evidence, IDET has seen a marked decline in clinical use. Patients and clinicians must weigh the potential benefits against the risks when considering this option. Radiofrequency treatments come in two main forms: continuous CRF and pulsed PRF. CRF uses high temperatures to ablate pain-transmitting nerves but has shown limited effectiveness and carries a risk of thermal damage. In contrast, PRF delivers short bursts at lower temperatures, modulating pain signals without destroying tissue. Studies on PRF report more favorable outcomes with significant pain reduction and functional improvement, though long-term benefits are still unclear. Both techniques require careful consideration of risks, especially with repeated procedures, as they may accelerate disc degeneration. Major concern with intradiscal procedures is the potential to accelerate disc degeneration, especially with repeated needle insertions or high temperatures. Studies on diagnostic discography, which uses similar techniques, have shown mixed results. Some research suggests increased degeneration and herniation after discography, particularly when larger needles or higher pressures are used. However, recent studies indicate that using thin needles and low pressure may minimize long-term harm. Still, repeated procedures, even with careful technique, can cumulatively damage the disc, highlighting the need for caution and judicious use. Considering intradiscal procedures for DLBP, clinicians must weigh the potential for pain relief against the risk of accelerating disc degeneration. For patients with severe persistent pain who have not responded to conservative treatments, a limited number of procedures using thin needles may be justified. However, frequent or repeated interventions should be avoided. Selecting the least invasive and most evidence-supported techniques is crucial. Ultimately, more high-quality, long-term studies are needed to clarify the true benefits and risks, guiding both patients and clinicians toward safer, more effective care. Despite the promise of intradiscal procedures, the current evidence base is limited by small sample sizes, short follow-up periods, and inconsistent study designs. There is a clear need for well-designed long-term research to better understand both the effectiveness and safety of these interventions. Future studies should use standardized protocols and transparent reporting to provide reliable guidance for clinical practice. Until then, intradiscal procedures should be used cautiously, with careful patient selection and a focus on minimizing harm while maximizing potential benefit.